This would have been way more manageable if they would have recorded it. There's like so many people she's gonna have to yell. Health assessment?
Kind of is, but not really. It's a little bit more in depth.
Well, they should play to record it so everybody can like just listen to it.
Just recorded that. No, just recorded it. I'll take your notes. Squeeze if you want to.
Oh no, I don't know. Maybe. Is it mine? Is my phone over here? No, it's right here. Sorry. Oh, that's one of those girls. Sorry, I thought you were talking about my phone. I'm just thinking like, Chelsea's never gonna be able to hear this. Like, there's no way. So better take good notes. But let's go, because it's 10 o'clock.
Now I'm like,
What is it all about? That's how I feel. To do it? I just messed it up. If we're ready.
I would say read it.
Study around. I'm sorry.
Today, I looked at the blueprint and it's a little bit different than what we had. Most of the stuff is the same, but some of it I won't be able to tell y'all what that is. But hopefully, I'm gonna try to give you most of it, so that'll kind of narrow it down a little bit. And I know I've been told to just focus on the blueprint. That's true. Just focus on the blueprint. Really, this is all. Yeah, that's all you need to know. Don't feel guilty if you don't look at all the other stuff, because it's so much material. It's hard to, cover it all. So just focus on what it's on the blueprint, and you will be affected for the test. Don't feel guilty for not looking at all the other stuff that they put on the notes. I mean, it's there, it's good to know, but for the test, you know. Okay. It's not in order. I'm not going to go down the blueprint because it's kind of like all over the place. I'm going to go to the maternal and mortality trend. I think that was on the blueprint. But know if they're increasing or decreasing and what's making them increase or decrease.
Can you repeat that? I'm so sorry.
Yes, for the maternal or all the trends, like know if they're increasing or decreasing, and why is it that they're increasing? Yeah.
But you know, I was just looking.
It was only in the first section. It's the moms. Yeah, it was like in the in-class section.
It's the mom.
Mm-hmm. And it's on the PowerPoint slide in the beginning.
Okay.
For the picture, I don't know if it's under Okay. So no, like the Catholic, you know, or they don't like contraception. Pretty much that there's a little slide that says providing spiritually sensitive care. Look at that and know which religions don't like meat or if they don't eat meat. Like let's say you have a kid in the hospital and their traditions or the culture doesn't allow them to eat meat. Like what would you offer or what you serve them? Something like it's kind of like that.
And like, for example, like Jehovah's Witnesses, you guys know that they can't do blood products, right?
Mm-hmm.
Muslim women, they said, like, I don't know if it was on the test, but it was in our lecture, something like, they expect, like, the moms, the grandparents, like, women to take care of them. So don't be surprised if they're kind of like doing the daily care for that patient. It's not like they're trying to overstep their boundaries, it's just like, you know, their culture.
Then I have the violence in the women. Like how would you assess it? What kind of questions would you ask to assess violence?
You'd make sure the woman was like alone, not with her husband, when you're gonna ask. And then you just be straightforward and honest, but like sensitive at the same time.
Okay, but what kind of question would you ask them though?
Do you feel safe in your home?
There you go.
It's the number one question.
Wait, what was the number one question?
Do you feel safe, like in a relationship or at home?
Here's the new one.
For the infant development, is it yeah, newborn and infant. So there's the table on the book that kind of goes through all the developmental stages they go through. Like at 2 to 4 months, the baby can hold a rattle. They can turn from side to back. They can hold their head up and support themselves.
Really know that. I know there's like a table in your book, right? Really know that because there's always a question in each test.
I think there was a select all that I'm know that like 4 to 6 months, what they use, 16 months.
And the birth rate, you guys know that they double by 5 months, right? And then they triple by the first.
She's a little bit about 1 year.
Is the fetal development on the blueprint, did y'all go over that it is? At 4 weeks, 8 weeks? Okay. We know that table is gonna be on there. I think that's also one of the selects on O5. It kind of gives them like 20 weeks. You know that, the sex has, you can see the sex already by 20 weeks. Specifically 16, but I think they group them all like by 20 weeks. What all, the baby, like what are all the things the baby has already that they can
Know when Hugo is present.
Like at 8 weeks, they're at high risk for carcinogens. Yeah, because that's when all their body organs are being born. At 16 weeks, you can see the sex. At 20 weeks, the heartbeat, you can hear it. The mom feels the movement. Know the vernix has formed, and they have Lenigo.
At what week?
20. And then, the auditory system is also complete. Auditory system is complete by 20 weeks.
And you said at 8 weeks they're at high risk for what? Teratogens. Oh, okay.
We should know how to pronounce it.
There's a chart in your book,
Yeah.
so you'll keep seeing that it's in your other tests. So just really familiarize yourself with that.
So would y'all say that the best way to study is to go through and look these up in the index and just go and look at the pages that it shows up on? Or how did y'all study in general?
Well, the way I studied, I didn't really read all the chapters. The first test I did because I was scared, so I read all the chapters, and there's a lot of info. So for the rest of them, I just kind of waited until the blueprint was out, then went back to the book and just really studied those sections in the book. I did look at the notes a little, but I feel like the book kind of helps more. It goes more in depth. And that's really what they test on.
Okay.
My book always.
And just a little tip, because you don't tell Mrs. But what we did for the last couple of exams, we divided up the blueprint.
It's a lot.
Find a group of friends that you really trust and they know what they're doing, and just kind of divide up the blueprint and just put it together once it's all done. That way, it gives you more time to actually study. Then trying to look up all the stuff in the book. And I feel like it kind of helped, but you don't have to. It kind of helps. Yeah.
I'll just have right now. Okay, so you have Erickson's theory, right? That's a big one too. Memorize that. There's always one question for Erickson. But then there was one class that had Piaget in it, and the second. So you guys know that the 8 stages, trust versus mistrust, is going to be on this test. So that's going to be the first stage. So, do you guys know what that means, what that entails? So, the child has to be able to you have to provide the child with the basic necessities, right? Like clothes, food, safety. So, if you do provide that, then they trust you. Obviously, if you don't, mistrust, right? But the thing with these they're not vocabulary, so don't expect that. How does it?
I felt like they did. It kind of asked the child, is a toddler, what stage? it was kind of, I mean, I felt like it was straightforward. Except for test 2, that one was kind of weird. Yeah. But for the first test, I feel like it was straight up dress versus dress. I mean, you kind of know what that means. It's not. Y'all have cystic fibrosis?
Yeah.
No. Yeah, we were on
I mean, it's pretty self-explanatory, right? Like, make sure everything's locked up. Is that what you guys, is that what they said for poisoning intervention?
They didn't really say anything except
No.
I think she talked about what ages are more likely to get into like cleaning supplies and stuff like that.
Yeah.
I think she hit on that, but then I guess the only intervention would be like helpful stuff at home.
I think it's like toddlers, isn't it?
There was a question about lead poisoning. But I would go back and look at that
Y'all have no
Yes.
So for that, you want to feed the child upright in an upright position. Do not pop the bottle. Avoid smoking inside the house or near the child. Or avoid exposing them to smoke. Teach him about vaccines. Discontinue pacifier after 6 months. Those are the main things.
Do you guys have like developmental milestones? So the thing I explored is, well, this is just what they're able to do. Like infants can roll over, sit up. They say 1 or 2 words. They use pincer grasp well. And what type of play do they do? Volunteer? Yeah, that was one. And when can they start cereal? 6 months.
So the interventions, I think we had it on your education team, that know for like the sinusitis, nasopharyngitis, know what you would do for those things. Kind of like, you don't have to know specifically for which one, but also like generically for a number of infections. Like you would, like for infants, you cannot breathe through their mouth. You can do normal saline. They can be administered in every 3 to 4 hours, especially before feeding, and then afterwards suction. Not after feeding, but after you do the saline drop suction afterwards. The decongestant nose drops, they should not be used for more than 5 days. You want to encourage lots of fluid intake because that's going to liquefy the secretions and help them kind of get them out. And then you can use antipyretics to decrease the fever. Remember, not aspirin, just acetaminophen.
For otitis media, breast milk seems to decrease the so that can be another change that you tell the mom. Another benefit to breastfeeding than formula feeding.
I feel like this is how I did my reviews. Just like, know this, know this, know this. Yeah. Well, I'm just happy they were like honest and just were like, go to the index and like just look up what goes with the topic, because that's all I'm gonna do. So at this point, there's really not that much time, and I just wanted to pass med search. I mean, I think this will be easier than med
How do
search.
you know if someone's like finished having respiratory distress?
Oh, they're not making noise.
Accessory disorder.
And don't they drool if they do?
Did you guys talk about SID, sudden infant death syndrome?
Yes. I don't think it's on the blueprint. It's not on the blueprint, but we talked about it.
So you went through and read all the chapters?
But after, know of the different zones, like what tells the parent to do, if they are like in the green zone, yellow zone, red zone. I don't think you have to know the meds. Yeah, I think that's important. But as far as like the long-term control, I don't really think you have to know that. But the only med, yeah, the doctor, that would be the only you have to know
Which med?
The Johnson. It's on the blueprint.
The only one. Told me that Dr. Johnson looked for weight gain.
Weight gain.
That is possible because of the zinc toxicity and it affects the kidneys. Kidneys shut down.
So for the cardiac disorders, so basically, like the cardiac cath for the kid. Know what to teach the family. I think there's a table in the book. For teaching the care after cardiac surgery. So you know, let's focus on the activity. Like you want to teach the parent to increase activity as tolerated. Don't let them play like roughly. Like don't let them run or anything that they're going to get tired real quick.
The tetralogy of Fallow, that's the biggest one that we covered and that we were tested on. The biggest thing with that one is the TET spell, when they crouch down like this and then they lean forward, and that helps with their breathing. TET spells.
Yeah, and you just know that it helps with breathing. Kind of like this So more teaching for cardiac surgery. You want to check signs, complications such as bleeding or bruise. in the increases in size of the catheter size. You want to check if the leg on the same side of the calf. You want to compare and make sure like one of them's not colder than the other one. You want to check for fever, and also teach parents to let them like be quiet, play, not like video games, puzzles, things like that. Don't let them like like fighting, none of that. Let the child relax. We don't have assessment for cardiac. Teachers for cardiac.
You've got just a bunch of
Just a heart failure and heart disease.
heart disease in general, yeah. Under assessment.
Yeah, because you don't have to know all the ones that cover.
I'm so wrong. It's just like, nope.
It's kind of annoying. They tell you like what to study, and like for a preterm infant assessment, you know how it's like one big chapter, and so kind of hit the high points for each of that topic in your chapter because it's just too much to remember, and you can have for like assessment the X-linked recessive question, and it can only be like one question, and then you study like how many pages of it. Does that make sense?
Mm-hmm. That's just frustrating. Don't do his 80 chapters.
So if you're going to focus on something for an newborn assessment, because that is a very large chapter and supposedly there's only one question, like what would you focus on? Because that's a huge chapter.
Like the assessment for like preterm, post-term infants do know those chapters very well because it will be more than like all the assessments. It's going to be more than one question for those assessments. But for things like X-linked recessive ovarian function, they're not going to quiz you or test you on those more than those bigger chapters. Does that make sense?
Because isn't it like what we'll see most? Like that's what they're going to test over. Is like what's most common in real life.
Have you guys had your med-surg looked at yet? Yeah. Do you guys appreciate that more than this? Yeah, us too. Okay, we're just going to go back to the genetics. Assessment, sorry. So you have X-linked recessive. So if it's X-linked recessive, do you see it in male or female?
Male? Oh, what? Males, right?
Who has an X and a Y?
Males.
Okay, so you'll see it in males because they only have one. So if with females they have two, so if one is, bad, then the other one kind of compensates for that. So if it's X-linked, you'll see it in males.
Yeah. See, I feel like this goes back to patho.
So if it's X-linked, the male has it, and if it's a female, then they're a carrier, but they won't show the trait. Okay. So for X-linked recessive disorders, you have like hemophilia, muscle dystrophy. And I think is Huntington's disease X-linked? No. But you guys don't have that, right?
Oh yeah, that's a good point.
What?
Color blindness
Colorblind?
is an X-linked recessive.
Where'd that come from?
Oh, hetero. So it would be like one is one thing and the other is another thing.
But for respiratory distress,
Yeah, that's on there.
no, like I think you get retractions, grunting, nasal clearing, and also know that murmurs, that's not abnormal. That's normal for a child to have them, and they should go away by 6 minutes.
Murmurs are normal.
I know why. Like, know how does that relate to the heart? Like, why is it that?
Because they're still growing.
The shepherd.
The shuns aren't completely closed yet. And then another thing for respiratory is their infants' breathing are really irregular. So that's normal. So they can have, I forgot what the term is, but they can have like a period of just, they don't breathe, and then they start breathing again, and that's normal.
That's why you have to take it over like a minute, right? Like assess them over a minute versus.
Yeah, you know how for adults you do 30 seconds when you divide it by 2, for infants you have to count for the full minute.
Minute, yeah.
For infants of diabetic moms, like know what the child's going to be like. The child may be hypoglycemic. Or they will be actually.
Because why are they going to be hypoglycemic?
Because the mom's been pumping insulin to them, so when they're born, they're like not getting insulin. Like theirs isn't the same. Yeah.
I know.
Oh, I saw it in the hospital. That's why I know.
Aren't they going to be bigger babies usually?
Huh?
Are they going to be a bigger baby?
No, they were tiny. Well, they were twins,
Oh.
and they were preemie. So I have no idea.
They're going to be big babies.
Oh, there you go, bigger babies.
The diabetic y'all have like the meconium assessment, all that meconium skills? Yeah, okay, so the main one, you just have to know the meconium skills. Know that it should be passed by 12 to 24 hours. If it takes longer than that, it can mean there's obstruction or something wrong with it. So just know if it's not passed by 48 hours, you start suspecting there's something wrong with it.
Yeah.
Do you guys know what it looks like?
Yeah.
Do y'all have to know the formula? Do you know the 5 to 10 weight loss? There's the formula.
We do. I don't know about it.
Yeah.
What?
No idea. It's like some kind of weight loss thing.
Did you write that down?
Yeah. So from that, just practice those. Yeah.
So basically, where you have to calculate the 5 to 10% weight loss, and that's normal for them because it's excreted through like urine, feces, and just all that stuff. So it's okay. But remember, they gained back that weight by 2 weeks.
Yeah, so just know how to calculate that. Yeah, I was so confused. I still don't know. But no, know how to calculate it. And if it's normal or not. Remember, 10 is your max. But you can, so So it's going to be something like, is this normal for the child to lose this amount of weight?
Yeah, that
Kind of
was a
like
test
that.
question.
Yeah.
Like, because you have to calculate the 5%, and you have to calculate 10% as well, and then it should fall between the 5 and 10%.
Oh, that was a practice question in class.
5% within like
Yeah.
2 weeks.
Yeah, but you have to know how to manipulate it in order to see if it's kicking that range.
It's just calculating a 5 to 10%, unless there's no special formula, it's just 5 to 10%.
Okay, so we're about to go through assessment, so it's a lot.
I just jumped around. Oh gosh.
Periods of reactivity. Aren't they most reactive, like within the first 12 hours or something?
Okay, so we went through the. Okay, well, I'm just gonna go through it. So we talked about the renal system, a little bit about the weight loss, right? So the 5 to 10%. And you do that with the original weight of the baby, right? Okay. So the immune system, the only thing like we remember is the colostrum in breast milk. It's just better to breastfeed because of passive immunity from the mom to the baby.
Yeah, like know your immunoglobulins. And I don't know if it was on this set, but one of those, like, which one causes the placenta, which one, kind of like, you have to know that information to answer the question.
So IgG crosses the placenta, and then the other one is IgA, which is from breast milk and the colostrum. Those are really the two biggest ones. We don't know if. Did you guys go over periods of reactivity?
Yes.
So premature babies, they don't have periods of reactivity. And the first period of reactivity lasts about 30 minutes after birth. And this is a good time to bond and initiate breastfeeding. And then the next one will be the next period after that is the period of inactivity, and that's when they usually sleep, right? And then the second period of reactivity lasts about 4 to 6 hours, and that's when they're awake and they're alert. And this is when meconium is commonly passed. Anyone else want to add to that? Because that's the only thing we have.
Do they typically ask, like, on those type of questions, like maybe a situation like when is best to feed the baby, when is best to bond with the baby, that kind of stuff, not like how long does each one last?
Yeah. I mean, you kind of have to know how long, because it says the baby is this many hours old. What's something you can teach the mom? Something kind of like that.
And you said the third was 4 to 6 hours.
Okay, so then we have the physical assessment of a newborn. So like Nelsie said, murmur is normal. It should go away after 6 months. You guys know how to do APGAR. Do you guys want to go over that, or are you good?
We're good.
Good? Okay. So what's a good score for APGAR?
7 to 10, yeah. But no one really gets 10.
They do.
She told us in class she wasn't like it's like that you know that if it's good then
Oh yeah. Uh-huh. Yeah, I'll say like the APGAR score is 8. You know. Okay. So you have fontanelles, and it should be soft and flat, and it should not be bulging or sunken.
Like, you know everything about
It was like, it was what?
The fontanelle. And you guys, like, if there's a little space, that's okay still.
It's just as a like
So if they're dehydrated, what is it gonna feel like? If they're dehydrated, it's gonna be a little bit sucky.
And like, no one's normal. Like, it should be soft, not flat or foamy or something, because that's an easy hydration. Like, no one's normal. And then,
Should be a
you know, it's supposed to be a diamond shape. And when it closes, I have that closed like 12 to 18 months. So, just kind of, yeah.
Molding, you guys know, because it's going through the vaginal canal, the baby is going through the vaginal canal, like it's gonna be, kind of pointed at first. That's normal. Not the fontanelle, but back here.
Yeah. Like, know the difference between the two types of molding?
Capit, that one, the Capit Succedaneum.
The one that has fluid. Like, know the difference between that one and the one that has fluid?
The cephalhematoma, that one has blood.
oh the one.
Yeah, and like, know how long each one of them takes to go away. Like, one of them, I know the fluid one, I think it takes, yeah, and then the other one takes a little bit longer.
Like 3 to 4 weeks
To go away?
for the blood.
And how long for the other one?
It's just within 12 hours
Oh.
after birth. So the fluid goes away faster than the blood one. For the face and eyes are pretty self-explanatory. Like, make sure everything's symmetrical, right?
And it's normal for the eye to be cross-eyed, right?
I don't know.
It's normal till about 6 months.
Yes, so, they have, like Milia and things like that. Yeah.
That's normal, right?
So just look in your book.
Identify the skin type. Things.
Are we doing assessment?
We're on assessment right now.
Yeah, it'll probably define it in that,
I think on one of them, like, they actually told you, like, fine
Or Baby Joe presents with tiny white bumps all over skin. What would you do? Blank, 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 blank.
A big thing about that is risk for aspiration.
which one?
Left lip. Oh, cleft lip.
Okay, so we'll go over circumcision, which is under patient family teaching. Okay, let's see. So you guys know there's 2 different ones that they use. They use the Placibel and the
Okay, so for the plastic valve, know that you do not apply control on the appointment because it may cause the thing to slip off, too soon, and you don't want that. Yeah.
And then for the Placibel, you just wait for it to suck off. Don't pull on it or take it off yourself. So you want to assess for bleeding the first 4 to 6 hours, and you want to wash it with water to remove urine and feces every diaper change, but you don't use like soap.
You just, what do you wash with?
Water.
Just warm water, yeah. It says with every diaper change.
And then for the Gomco and Mogan one,
Can you say it one more time? Sorry, it's kind of hard.
oh, it's okay. The Gomco and Mogan, you can use the petroleum
Know what the difference is between the two and like how to scale for each one. And I think the main thing is the petroleum, like for one of them you do apply and the other you don't. Teach the parents to check for bleeding every diaper change. If they do have bleeding, you want to tell them to apply gentle pressure with the gauze. If it doesn't stop, then you can go doctor. The glands will be dark red and have a yellow exudate within 24 hours. So that's normal. That's good. We want that. So don't tell the parents to remove that. It's a good thing. It's a yellow exudate. So that's good. Then the exudate is normal. It should last for 2 to 3 days. Do not attempt to remove it. Avoid commercial wipes because they contain alcohol. Use soap only after circumcision is healed, approximately 5 to 6 days. The Gomco and Mogan clamp only, you want to apply from jelly. And then observe for any infection, which we know is the swelling, discharge. Do y'all have small for gestational age? Is it on the basement?
They talked about it, but I don't
Wait, small for gestational age, is that preterm babies?
The preterm is the born before like
Yeah.
28 weeks, and the small for gestational
Oh.
they're low in weight.
Yeah, okay.
small, less than 10%. Average is
Sorry, guys.
So yeah, for the preterm, this one definitely the infant. They're gonna have a weak cry. They're gonna have more lanugo. They're gonna have decreased muscle tone and diminished or absent reflexes. They're gonna have an immature suck and swallow and breathing patterns.
What's the breathing pattern?
They're gonna be immature. Yeah, they're gonna have. Yeah.
They just wouldn't be able
Yeah.
to
It's gonna
suck
be
or swallow.
yeah.
That's a jaundice, right?
And then also the temperature instability with preemie babies, it's common. So because the heat loss is more significant with them, and they have poor muscle tone. they don't have the brown fat.
They don't have that much brown fat. Do you guys know what brown fat is?
And also they have decreased or absent reflexes.
Okay, so you have jaundice. So all newborns must be monitored for jaundice at a minimum of 8 to 12 hours. So it's the jaundice becomes visible when the bilirubin is greater than or equal to 5 milligrams per deciliter. So that's what we can actually ask you, like, so you have, so now, at least for our tests, know what physiological jaundice and pathological jaundice is. So physiological, it's normal. It occurs after the first 24 hours of life, and when you see a child having physiological jaundice, you just want to encourage the mom to breastfeed, and that usually helps secrete that bilirubin. So some of the risk factors, like I said, it's just delayed feeding. So you want to ask the mom when was the last time she fed her baby, or if she's breastfeeding, or if she's just not feeding her child as frequent as she should. Yes. So ask her when was the last time she fed her baby and how often she feeds her baby. And then you have pathological jaundice, which occurs after the first 24 hours. And this is the bad one. And the treatment is going to be worse than the first one.
Yeah.
It's worse it occurs during the first 24 hours. Sorry.
Oh,
It's confusing. Because the other one's after.
Because I think that was a test question. It says something about like the baby was how many hours old, and then the mom noticed that it started.
So
Baby started changing
physio
colors,
is
so,
during.
That's basically like either patho or physio.
She
And
said.
like, no, we can't know
Okay.
which one needs treatment and which one doesn't.
It seems
But
like it's
even with the pathological jaundice, the first thing you want to do is the breastfeeding. So.
It doesn't have to be breast milk, but just increase feeding.
Do you guys have photos?
Do you guys have any questions?
On your assessment.
That's next.
The function, like know which hormones it secretes.
What is the secret?
What was the question?
placenta, know what hormones it secretes?
Yeah, just know what all does it do and mainly which hormones it secretes.
What's the hormone of pregnancy?
Progesterone.
Is there anything else we missed? Sorry we're jumping all over, but
It's alright.
is there any other topic you guys want to go over?
Complementary and alternative therapies, like what?
What did anyone do? What the hormones? I don't remember.
It's estrogen, it's progesterone. I remember that was his assessment.
Yeah, just.
So which one is it? Estrogen and progesterone.
I think there's a question at the end of class on the board about it.
Yeah.
I just don't know what's written.
Yeah. The placenta.
Are like the meds that they're gonna ask about when it says like newborn meds? Is that just gonna be like the eye stuff, the like Hep B? Okay.
The vitamin K.
Yeah.
I have a question about that. They had it's under teaching and it says newborn medicine. And so like, what teaching?
You teach a Y, I think.
So, okay.
So like if someone's doing the ophthalmic ointment on their baby and they're like, why are you giving that to my baby?
Cause gonorrhea.
Which ones are mandatory?
State regulated.
Yeah. What would like complementary and alternative medicine therapies be? Because I didn't really remember her. I mean, maybe I missed it, but
Like with pregnancy, like there's different things, like they shouldn't have herbals in the first trimester.
oh, okay. I just thought it was like there was ones that like they used on them. No, but if it's not that, then I get what you're saying. Yeah.
Folic acid.
Yeah. That's kind of what I was talking about. I didn't know if it was
About the Johnson.
page what?
1323. Yeah. Yeah, like no other therapeutic
It has on the blueprint, it just says ovaries. Not the ovaries, but.
Ovarian function.
I got page 48 for that. It's in the book.
Page 48?
Yeah, that's where it's listed.
Page 48.
Yeah.
how it's
Yes.
supposed to feel and look like.
Oh, okay. I think I remember.
I feel like it's like a lot of common sense, which is like scary. Yes.
I mean, they're your numbers.
And then these are page numbers and basic stuff. Yeah, that's what I'm
I think the hypovolemic shock is for the mom. Like C-section and stuff. Yeah. I'm pretty sure. And it's just like this symptoms. You're assessing for the symptoms. Page 13.
Did they go over drugs about what's supposed to
I
help
don't know
the
if
uterus
it's this one,
contract?
but do you guys know, did you talk about Dirty Duncan and Shiny Shock? Okay, which one do you want it to be?
Shiny shoulders.
Okay, and so for Dirty Duncan, I think that, I don't know if it's gonna coincide with the hypovolemic shock, but if they have Dirty Duncan, what do you check on that placenta? Because if there's anything missing,
Oh
if
yeah.
there's something missing, that mom will continue to bleed. And so that might be, I don't know.
That was like a flashback from sim lab.
It mentioned it in Sim Lab.
Yeah.
In Sim Lab.
Yeah.
So it's a person.
What's preconception care?
Probably like don't smoke, don't drink. Yeah. Get genetic testing.
I'm pretty sure that was a test.
Wait, what?
The umbilical cord has one vein and two arteries.
Okay.
Is that more about the fertility or is it about
I think it's more like helping the parents to understand what their risk is for introducing like an abnormality.
stuff like that.
Was child abuse like
It's like
straightforward?
therapeutic communication. And also just let them know that just because they can't have a kid of their own, there's
Preconception
other
care.
options too.
Yeah, like therapeutic communication.
And if there is a problem like conceiving, do you check the male first or the female?
The male.
Anything else, guys?
With child abuse, is that just straightforward? Like if you see bruises on the kid, like
I think they said like inconsistent or like the
inconsistent story?
fake bruises and stuff like that.
Oh, okay. Like kind of with health assessment.
Different stages of healing.
Okay, so it's kind of just like basic. I just want to make sure I'm not missing something.
Yeah, it's not too difficult. It's kind of like the movie. I feel like it's more in depth. So we need to look at
Okay.
the notes are helpful, but we definitely
Oh, what was about the conversion? We needed to convert pounds to, what was it?
It's grams to pounds to grams,
Okay.
and then inches to centimeters, I think. Because if you measure the baby in both, but you don't want to tell the parent that their baby is however many grams in centimeters because they're going to That's what.
Okay. So 1 pound is 152.2
What is it
grams.
like with the hotel room? That's pretty vague.
So we would need to know that.
You go quick.
You have that on Google. How do you do that?
Sounds right.
They're like uses babies 1,000 grams. Means they're 1 kilogram.
Oh,
And then you times that by 2.2 to get pounds.
in prenatal care. 1 pound. Essentially 1 gram.
Yeah, whatever.
Did you like that?
Did everyone sign in?
No. Yeah. Do we need to sign in like?
It just comes, I think you get points for the, and then the name.
Yeah, okay, I'm not signing in.
Do you guys have any other questions?